So today we're going to talk about vitamin D and calcium. It's actually quite interesting. The symptoms of a vitamin D deficiency are very similar to a calcium deficiency. So let's just kind of go through vitamin D first. If you're deficient in vitamin D, you could have chronic low back pain. You could actually have bone pain or pain anywhere in the body, but a lot of times it's in the lower back. In fact, that's one of the first symptoms. If you're calcium deficient, you can also have achy muscles and achy joints as well. Next one is muscle weakness. That could be coming from a vitamin D deficiency as well. Muscle spasm, okay? In a calcium deficiency, you could have muscle cramps in the calves, in the feet, but not having enough vitamin D can cause the calcium deficiency because one of the functions of vitamin D is to increase the absorption of calcium by 20 times, okay, in the small intestine. Nonspecific pain. So it could be like fibromyalgia or some weird pain, but it's hard to identify, that maybe migrates and changes. Daytime drowsiness. So let's say during the day you're driving or you're just doing work and you just want to take a nap, but you know you're not tired. Okay, it could be your vitamin D levels. Also mood changes too. That happens in the winter because you're not getting enough sun. High blood pressure, that's more of a long-term vitamin D deficiency because without vitamin D, your arteries get stiff. Okay, and then low immunity. So you can have a respiratory infection. Now, when you're sick, maybe your mother or your grandmother told you to consume cod liver oil, or you might have heard that before. Cod liver oil is loaded with vitamin D and vitamin A, really good for the immune system. So as soon as you start getting sick, you should take that. But vitamin D, it's intimately involved in the immune system, and it actually even acts like a hormone as well. Okay, sweaty head. So let's say, for example, you have an infant that just is sweating excessively in the head, or a small child. Give them some vitamin D. Structural problems in kids or even babies. I'm not sure if you've ever heard of a condition called rickets. The most common cause of rickets is a vitamin D deficiency, but you can also develop it from not having enough calcium. So in rickets, you have soft bones. So you increase the risk of getting scoliosis, your knees become bowed or knock-kneed. You have a lot of structural problems in the teeth, all sorts of issues with that. Okay, now in calcium, we have aches, tingling in the lips, the mouth, the feet, and the hands. And this can also mimic a B1 deficiency as well, because you can have peripheral neuropathy. So you get muscle cramps, bruising. Okay, you see that in the lower part of the body, in the extremities, like in your legs. Fatigue, which is similar to this right here. Throat spasm, so you have this chronic cough or irritation in your vocal cords. Okay, then you have tetany, which is a little twitch underneath the eye or the arm, or even any large muscle can actually twitch because of low calcium. Also, one point about calcium is that you need a certain pH for calcium to be mobilized. So if your stomach is too alkaline, not only are you going to have acid reflux, you're going to have the appearance of calcium deficiencies because you can't mobilize calcium that well. You can't absorb calcium and other minerals that well. So if you don't have the right pH in your stomach, you're not going to absorb minerals. So sometimes it's difficult to know, do you need vitamin D or do you need calcium? Most people do not need extra calcium, and I don't recommend you take extra calcium. I recommend you get your calcium from food unless you have osteopenia or osteoporosis, because a lot of times people are just taking way too much of this in a pill form and it's creating a problem. I would imagine most people have too much calcium, it's just not mobilized enough. But what they really need is vitamin D to release this right here through the body. Now, yes, you can get your calcium from dairy like cheese and things like that, but you can also get it from leafy greens like kale, spinach. Well, the problem with spinach, even though it has calcium, it has oxalates which actually bind the calcium. So you'd have to either steam it or cook the spinach, then consume it to get the calcium. But I would recommend you get your calcium from other greens. I put a link down below for more information about good sources of calcium. Now, if you have a problem with your kidney, you won't be able to absorb calcium that well. I already talked about not having enough in the diet and also not having enough stomach acid, and you can also have a parathyroid problem. This usually occurs if you have your thyroid removed, because the parathyroid glands, there's 4 of them that are attached to your thyroid. So many times when they take out the thyroid, they remove the parathyroid, and now you have a calcium issue. There's other reasons, but they're rare. EMF, electromagnetic frequency, okay? It's coming from the cell phones and the Wi-Fi. When you're exposed to EMF, it drives the calcium inside and you have all sorts of issues. So again, there's a lot of different causes to problems with calcium. And when you have too much intracellular calcium, you also can at the same time have a calcium deficiency because the calcium is unavailable to you. It's locked up inside the cell where it should not be. And that's why even doctors will give something called calcium channel blockers to lower blood pressure, because there's too much intracellular calcium. Okay, glucose. So if you're consuming a high carbohydrate diet, you can have low calcium from that. A lot of people have insulin resistance, which actually then could increase the insulin and also create a problem with calcium. And lastly, you can be just deficient in magnesium. And again, magnesium and calcium are together. Without enough magnesium, it's going to be hard to balance out the calcium. And this comes from the leafy greens. How do you become deficient in vitamin D? Well, no sun, it's winter. You don't consume fats. Let's say you're on a low-fat diet. Well, guess what? You get your vitamin D from fats, fatty fish, liver, egg yolks, but you can also get it from mushrooms as well. Now, one of the best sources of vitamin D from a food base is cod liver oil. Now, if you actually are missing a gallbladder or have a gallbladder problem or a fatty liver or a problem with the liver, you won't be able to absorb vitamin D as well because you need the bile produced by the liver and stored in the gallbladder to be able to absorb and break down and utilize this right here. So no gallbladder, problem with liver, low vitamin D levels. So you have to take more to create the same effect, or take it with purified bile salts. And also, by the way, I have a vitamin D supplement. And the reason why I created one is because I wanted something that had vitamin K2 in the right ratios. Vitamin K2 works with vitamin D3 to transport calcium in the right place. But I recently added another ingredient, which is called purified bile salts, to increase dramatically the absorption of both D3 and K2. So I put a link down below for more data on that. So if you don't get enough sun, you're going to be low in vitamin D. Low-fat diet, low vitamin D. Stress, high cortisol can block vitamin D. Gastric bypass, vitamin D problem. A colon issue, let's say you have irritable bowel syndrome or some type of scar tissue in your colon, it's going to be hard to absorb vitamin D. If you're taking too many sun blockers, well, you're not going to get vitamin D. So the relationship between vitamin D and calcium is interesting. The symptoms cross over. You have to look at the big picture. Most of the time, people just need more of this and not this. All right, thanks for watching. So to prevent me from running out of content, I have a new survey. I want to find out what you are interested in. So please fill it out. The link's down below.